I'm Dr. G. We're going to take a look at hip pain today, particularly in runners. There's a lot of focus given on muscle strength, but a lot of times the actual hip joint is jammed up when you put a lot of mileage on the joint. One of the easy and quick ways to assess is having the patient laying on their belly, bend their knees to 90 degrees, then you let them hang out to the sides. If you see an asymmetry between the two sides, as you can see here, her left has a good bit of motion, but her right is pretty limited. What that means is the hip is not internally rotating, which is very important when you're running to take stress off the hip joint. So it's essentially constantly stuck in an externally rotated position, which puts a lot of force and stress on the joint. When you're constantly running, putting all that mileage in that position, the force goes right through the hip, a lot of times wears down at an area called the SI joint, or the sacroiliac joint. And that refers pain anywhere from the back to the front. You can actually have pain right in here, which is mostly called the hip flexors. Problem is, you try to stretch it out, it comes right back. Chances are it's that hip joint causing stress on the SI joint, causing that referral pain. So a lot of times when you come in with this kind of pain, by the time you have pain in the back, especially if you're a runner, it's usually too late. So a lot of times it actually starts at the hip and the force causes pain in the back area. And you hear a lot of times referral pain or radiating pain. They're slightly different things. Radiating pain is usually coming from the spine, where the nerves come out of next to the joints, and if there's impingement of the nerve or anything like that, that nerve that feeds all the muscles in your legs sends a signal to those muscles, and you feel the pain where those nerves innervate. Radiating pain, referral pain, very often happen from the back. So you can have pain in the butt, but the pain's actually in your back. But with runners, hip pain is usually the cause that leads to degeneration in the back or compensation. So if you ever, as a runner, get pain anywhere on the outside of your hip, in the front of your hip, get that checked out sooner than later so it doesn't lead to constant wearing away. It's not one of those, I'll run through it, I'll tough it out, because it's only going to get worse.